This is a mom from Florida whose 10-year-old is afraid of something he needs to survive: food.
My son has a fear of choking on his food, and he's had 2 incidences in the last year and a half, and it's not getting any better. What can we do about this?
Now, fear of choking. I mean, a lot of people might not think this is very serious, but actually for some people it can be a very real fear and almost move into the OCD category, where they just have a really hard time eating anything because they have this fear of choking.
Now, is this after a choking episode that they've experienced?
Yes, it usually happens after a choking episode. And you know, of course, if you go through that, it's scary. If you've had the Heimlich done to yourself, it can be scary, and you remember that, and you have a really hard time with certain textures after that. And you know, especially if some kids, maybe even before that happens, they might have a strong gag reflex or something. They might be more prone to this. So there's a few things you can do. First off, recognize that it's real. Okay, this is a real fear. Don't blow this off. And then, you know, it needs to be kind of a multi-pronged approach. You need to look at the medical. I usually have these kids see a speech pathologist to kind of work with their swallowing, maybe even get a swallowing study, a barium swallow, to make sure their muscles actually do work. Okay? And then if we can find out that there's no medical reason for this, and then we kind of maybe more focus on the behavioral. Maybe an exercise of simply counting the chews. So the person is more focused on the counting, and then kind of forget about the normal process of swallowing.
But some kids do have more trouble swallowing certain things than others, just like some kids can't take a pill.
Exactly, right.
So for whatever reason, so it's worth getting a formal evaluation
and
just to make sure there's not a structural problem.
Exactly.